trying to think how to approach this video, and I think I'm going to use a dead and pulped tree to do it. So this is Kumar and Clark. This is, I mean, heck, it's called clinical medicine. It's basically what you need to be a clinical medic. And it's in depth, it's prodigious, you know, it's realistically more knowledge than I ever assumed I would be able to put into my head at medical school. And if you know this, you're pretty much bomb-proof as a doctor. Yes, this is an old copy. There's a reason why I keep it around. It's an old copy, so you need to keep up to date, but ultimately this will cover you. Now, if we turn to the index, which is how the world existed before Google. If we go to erectile dysfunction, page 1000, we've got 4 pages and, you know, it's quite dense, explaining about erectile dysfunction, how to manage it, what to look for it, etc. This will cover you for dealing with most conditions, assuming you're up to date with a management plan. The reason why I highlight that is it's quite often that I'll have a patient come in who has done their own research and they've brought several files and things and they want to change something or they want to do something that's atypical. And that's like having the knowledge in Kumar and Clark. The problem is, and this is the second textbook I keep on my desk, this is a big weighty tome. This is an inch and a half's worth of knowledge and wisdom on erectile dysfunction. My point is, there is no way I know an inch and a half's knowledge on this, despite owning the book. I largely use it as a prop. The point is that as a trained medic, I probably know a lot about many things. As an expert patient, you probably know, let's be frank, even more about your particular condition than I do, potentially. But the likelihood is that neither of us have 1.5 inches worth of knowledge that a specialist who has dedicated the entirety of their career to working on has. And hence why, in situations like that, it's important that we both appreciate that we don't know things and that we may need to go and get a secondary opinion. And this is sometimes very demoralizing for patients when a doctor says they don't know something. I would flip that around. I would say that's really important. If you've got a doctor that says they don't know and they're going to get help, that means that they know that they don't know the entire contents of this book and they're treating you well. I'm always worried about anybody who knows everything about everything. Probably means that they don't. And that applies to medicine and patients too. Take care and I'll see you in the next one. Cheerio.